presentation. Okay, so when we are talking about health, we need to know that our health is our greatest wealth. That is the first thing. You cannot bargain that, because there is no price tag that you can put on your health. Until you get sick is when you realize how much you can spend on your health just to live a healthy life. And you won't enjoy your money if you're not healthy. You'll just end up spending the money in hospitals and medicines and bills. So one thing we need to know is we need to take good care of our health above all, because health is one of the greatest gifts that God has given us, and we need to thank Him. So when we are talking about health, you look at my screen, you see that since 1950, since after World War II, the scientists came and realized that people are no longer getting sick because of common cold or pneumonia. There was no longer such diseases that were coming up because of viruses and bacteria, but now things were changing. People are starting to get sick because of chronic diseases. And they realized that the first people who began getting sick were first the farmers. And it was because the farmers started getting exposed to a lot of pesticides and insecticides and a lot of chemicals that they started experiencing chronic diseases. So during that period is when research started becoming wide, and some diseases started to be named, because there were no names for such diseases, and they started putting effort in such researches, and they realized that the reason why people are getting such diseases that have no cure is because of the lifestyle they live, what they expose themselves with, what they eat, what they inhale. So they realized these were chronic diseases, so they categorized them into the chronic diseases. And examples are heart disease, we have chronic respiratory disease, we have stroke, we have diabetes, we have cancer, we have obesity. There's so many chronic diseases in those categories. So they realize that as the age goes on, the world becomes more processed, and the foods that we are now taking in are becoming very, very unhealthy, that lack a lot of nutrients in our system. And they said by 2020, the rate of chronic disease will have increased, especially in Southeast Asia, Africa, and the Eastern Mediterranean area will have increased by 20%. And we can see that, we already can see that the people around us are getting attacked by such diseases. And even young people are getting diabetes. A child who's at the age of 9 years old has diabetes, or even a child at the age of 5 years old has diabetes. So they realized this thing had started becoming big. So they sat and they had to come up with a solution. So World Health Organization sat and realized, well, apart from World Health Organization, many health organizations sat, did their researches, and realized there are only 3 ways you can be able to prevent this. There is weight management, physical activity, and eating a diet that is rich in food nutrients. And for those who expose themselves in chemical areas or industrial areas, lots of supplementation. So our topic today is heart health, and heart has many. When we talk about the heart is, the heart includes the arteries, the veins. We also have the blood, the pumping of the blood to other parts of the body, and through the blood comes to the heart and is pumped all over the body. So if you have an issue with your heart, I can assure you, your body parts and other areas will not receive good flow of blood, which is also good flow of oxygen in your system, and that is how you find yourself with issues. So when we're looking at the heart health, an example that comes is atherosclerosis and oxidized cholesterol. As you can see on my picture there, that is an example of a buildup of fats or cholesterol on the walls of the artery. So plaque is formed on the walls of the artery because of rupture that happens on the artery. So why a plaque is formed on your artery is because you have a rupture in your artery that has to be plastered and protected. Your body is when God created us, He created us in a way where our body can heal itself when having an issue. It alerts itself when there's an issue. So when you have a small tear in your artery, what the body does, it alerts the brain, and the brain starts sending some collagen. It's a clot of blood and fats, especially cholesterol. It's a buildup of a lot of cholesterol. So it starts picking cholesterol from anywhere it can find and starts plastering it on the artery. So what happens is, if that artery continues having more damage, more clots are formed, more plaque is plastered around the walls of the artery. And what happens is atherosclerosis is caused. And it's actually a rupture of the blood vessel of the arteries. What it does, it blocks your blood flow because of the amount of fat that is plastered on the wall. So this is how it looks like. There is a normal artery, as you can see there on my picture, and then there's blocked blood vessels. Blocked blood vessels, which means the arteries have been damaged and the body just keeps depositing fat on the vessels to protect it from getting damaged more. And what happens is the blood flow becomes quite short. And this is what causes hypertension, because the blood is actually struggling to pump, the body is struggling to pump blood in that area. If your blood pressure is 140/90, it goes at a rate where it's 180/120, because the force is too much. It's no longer as easy as it used to be. The body has to use so much pressure to pump the blood into that artery that is clogged. And this is very bad, because this can actually cause heart attack or stroke. And one thing about high blood pressure is, if it goes untreated, it can lead to other heart conditions. So we see that there's a connection with the plague and everything. So you also need to watch over your heart. As you can see there, there's an enlarged heart, which means there's so much high blood pressure in the system that the heart has to get enlarged just to occupy the amount of pressure that your body is using. Then you can see another heart issue we have is angina. It is a symptom of the coronary artery disease. You feel like your heart is squeezing. There's so much pressure in it, tightness, that pain in the chest. I have experienced a certain pain in the chest, but I don't think I've experienced it as bad as people who have angina have. So it is also caused by the plaque that forms on the blood vessels. So the funny thing is, the plague causes so much in the body. And the sad thing about the plague is, you cannot see it being formed. You cannot know if your body has plague. You start realizing your body has plague when you start getting high blood pressure and angina, atherosclerosis, such things, because you're going to hospital because of the tightness in the chest. So these are some of the causes or some of the diseases. You can see there's a blocked coronary artery, and you can experience a period where your artery is completely blocked, completely. That there is no blood flow. And that can actually also, if you have that, it can lead to stroke. As you can see, stroke majorly happens in the blocked vessel in the brain. So it could be a clot that was in your body that traveled and ruptured the blood vessels, which starved the brain from receiving oxygen. It starved the brain from oxygen. So what happens is, when it damages the blood vessels, it usually blocks the vessels in your brain. There is no blood flow going to your brain. You get a stroke, and a stroke can lead to paralysis or numbness of the face, arm, or leg, or even some people get numb on the right side of the body or the left side of the body. And it's not a good thing, because you have to go through therapy. There are people who never heal from it. There are people who are told, this is how you're gonna have to learn to survive. Half of your body is not gonna be able to function and communicate as it is. So this is a serious thing, because we all know that for something to happen, neurons in your body, the message receptors, we all have receptors in our brain. So if anything is to happen in your body, it sends a receptor to the brain for something to happen. So if you have stroke, that damages a lot of things that are going to happen in your body. So you need to be careful. And another thing about this stroke is the fact that we cannot see when it's happening. You cannot really know when it's happening because you do not see the blood clots that is forming in your brain. So that's a very bad thing about heart attack. And that is how a blood clot looks, as you can see there. Only it's just, there are a lot of the body, we've all seen how a blood clot looks. We've been cut or we've fallen down and gotten bruised and you are bleeding, and then the next day or in a few hours there's a dry blood around your wound. So that's what a blood clot is. The body is trying to seal where it is ruptured. So the body works so fast, and one thing, you can't even stop a blood clot. So it works so fast. And a blood clot is good when it's outside the body in an injury, but it's terrible when it's in the body because it will travel around the body. And if it goes to the brain, that's what happens. You end up getting a stroke. It may also go to your heart, because I know that because my father had an issue. He had 3 clots in his heart, and it was bad. He was admitted in ICU for quite some time. And it wasn't good. When we visited him, he had to be put for the oxygen bag, so he can breathe, because he couldn't breathe. Blood wasn't flowing to his lungs. There was no airway going. And this is quite dangerous. I can assure you it is dangerous. But one thing you need to know is all of this is caused by how we live our lifestyle. How you choose to live your life is what determines whether you will have heart disease or cancer or diabetes or obesity or chronic lung issues. And the solutions are usually simple. So in the past, because there was no medication, there was no medicine for high blood pressure, all these things, the doctors would offer their patients good solutions. They would tell them to increase their diet in the things that will help thin the blood, or in the things that will help remove the plague that is forming in our arteries. And the way you can prevent this, yet also stop it from exceeding to become an untreatable manner, is by having a good diet. You need to watch your diet, and I'm going to discuss that briefly. But you also need to exercise. Exercise is for everybody. Everybody. No one is exempted from exercising. My grandfather is at the age of 80 years old and he works in the shamba. That is exercise for him. And just because we work in the offices doesn't mean you cannot exercise. So you need to put time aside for you to work out, to exercise, to take a walk, to take a run. It is very good for your body, very good for your heart. It will strengthen the walls of your heart, and it will allow equal blood flow in the system. It also burns excess cholesterol in your body, which also may lead to the heart diseases that we have. So when you're exercising, we all need to check our BMI. You have to know where you stand. Are you at a normal BMI? Are you overweight? Are you underweight? Are you obese? Are you morbid obese? You need to know where you are. But one thing you need to do is you need to make sure you're between 19.5 and 24.5. Nowhere above that. That should be your BMI. And you should consult the person who invited you so you can learn to calculate your own BMI. We have people who are at risk of getting heart disease, are people who are diabetic. You need to take care of yourself if you're diabetic. Eat well, because apart from being diabetic, you might get heart diseases like high blood pressure. So many people who are diabetic are also given medication for high blood pressure. You also need to avoid smoking completely. Avoid smoking. Smoking is completely not good for your system. And you need to supplement. You need to supplement on carotenes, vitamin Bs. Bs, we have B3, B6, B12. You need to supplement on vitamin E. You need to supplement on garlic, calcium, magnesium, coenzyme CoQ10, quite important, amino acids. The body cannot produce all the amino acids in our body. So you need to supplement on all of this. So I'm going to look at the health part. And these are the things you need to avoid. And also avoid stress. I forgot. Avoid stress. Some of us are getting heart issues because of stress, especially high blood pressure. Avoid stress completely. If people around you are stressing you completely, it's time to, I would suggest, go to your God, or take a time off, you know. Don't be around people who stress you completely. And I know we can't avoid them because most of them are our families, the financial issues we have. So just avoid stress. It's not good for you. It's not good for you. Don't think too much about an issue, especially if you can't solve it. If you can't solve an issue, there's no need of thinking too much of it. So one thing I like is the fact that New Life, when they came up with this company, because it came in 1958 after World War II, they were focusing on health. That was their main goal. Their main goal was to help the world become a healthier and happier place. That was their mission. And when they came up with this is our founder, as you can see. His name is Jerry Brasfield. So Jerry Brasfield started this company when he was just a young guy, came from a not so rich family. They didn't have much. He couldn't afford to go to college or campus, but he had a dream. He really wanted to help grow his future. And when he came up with this company, he wanted to come up with a company that will help people to how to prevent diseases around them, like chronic diseases, some viral infections. So he came up with scientists, many scientists. He had a foundation of scientists who worked hand in hand with Jerry. As you can see, he had a great dream, and that's his daughter, Kendra Brasfield. She's now the CEO of the New Life International. She's doing great things in this company, and she's just at the age of 28. So this is great. He has mentored her daughter to take her footsteps and to continue the journey and make the world a healthier and happier place. As you can see there, this is the Scientific Advisory Board. This is Dr. Arthur Fast. We all can see Dr. Arthur Fast. Here he is. So he is the pioneer in cancer research and toxicology. We all know that. He was one of the people who came up with the idea of chemotherapy, and yet he stated that chemotherapy is not good for the cells. It actually kills also the good cells. And he said prevention is better than cure. So they came up with a scientific advisory board of well-knowledgeable scientists who are published and respected in many areas, especially in the areas of research. And they came up with many categories, because you know we have health supplements, we have people who deal with foods, we have people who deal with the production of the supplements. So they came up with they're very well known scientists. You can go and Google them, written in articles, done great jobs, great wonderful works in your life. Especially they've been published in a lot of articles in the US, and known to have produced many wonderful products that some are not even actually in any other company. So as you can see there, that is the Scientific Advisory Board. So when I'm talking about health, you need to keep an idea of everything that is here. I have just mentioned about exercise. I have mentioned about rest. I forgot. Rest. You need to sleep. Nobody is immune to sleep. No one can say they can go 3 days without sleep, because you'll be a walking zombie. You'll feel like you're in a dream. Everything will feel like a dream. And sleep is so crucial, because when a study was done where they called 3 people, and you know they pay them, they told them, we want you not to sleep for 3 days. We want to monitor you and see how your body works. And they realized that these people were actually, their body was not digesting food well. They were getting thinner. Their eyes were they had lots of eye bags. They were slower. They couldn't even do the simple math that we can do. It was actually very hard for them to do. The concentration was quite low. So you need to sleep. You need to sleep 6 to 8 hours daily, no matter how hard it is out here. No matter how hard you're trying to look for money, always remember, even though you get the money, your body might fail eventually, and the money won't be worth spending in a fun way. So take care of your health and relax. And it's good to take yourself out once in a year. Go for a vacation. Go for a cool off. Go cool off from all the stress in the world. The world is God gave us a beautiful world here. It's very gorgeous around here in many places. So it's good to at least take some time off and relax. When we look at diet, we see 95% of people deliberately eat foods that lack nutrients. It's like they want to. It's deliberate. And 75% consume harmful substances. We have people who are smoking, people who taking so much alcohol. We're exposed to so much fumes. There's so much medication we're being given by the hospitals and the doctors. So there's so much harmful substances that we are being exposed to. And when we're looking about the diet, that is the BMI, like I mentioned. As you can see, it has to be 18.5 to 24.9. You have to be at normal. And you can calculate your BMI. It is weight in kgs over height in meters. So you just multiply the meter, your height. Yeah, in meters squared. So it multiply your height by itself. Then yeah, the weight divided by the height. So that is how your BMI should be, as I mentioned. And I can assure you, people who are obese and overweight are prone to having a lot of high blood pressure and heart diseases. That is for sure. Well, here is a food pyramid on how your diet should be. So the USDA Health Daily Food, this is what they came up with. They said you should take more of breads and grains and other whole grains in your system. And they mentioned that you need to take whole grains. I'll repeat, whole grains. It has to be whole, not anything refined. Whole means venye tu ilitoka kwa shamba ndivyo ambavyo utaila. Kama unaipeleka kwa posho mill isiagwe, isitolewe vitu, isiagwe hivyo hivyo mzima mzima, uikule hivyo. That is whole grains. And people don't do this, but you need to take a lot of brown. If it's chapati, take brown chapati, brown ugali. Take a lot of mokimo, take a lot of githeri, take a lot of brown bread, not white bread, brown bread, and not just brown bread, whole bread. We have to take oats in our system. If we're taking rice, take brown rice. There's brown rice out there. So a lot of whole grains is key in our body because it's good. It feeds our cells. We have fruits and vegetables. Take lots of fruits and vegetables. 5 to 13 servings of fruits and vegetables. Every time you're having a meal, make sure the plate of food you have has fruits and vegetables. Don't just put starch and proteins and forget about the fruits and vegetables. So always make sure that your plate of food has lots of fruits and vegetables. Then every day you should make sure you've taken 5 to 13 servings of fruits and vegetables because they have beta carotene, which is good to reduce the heart. It's good for the arteries. It's good for the thinning of the blood. So you need to make sure you have lots of fruits and vegetables. You have proteins. Take lots of plant proteins and minimal animal proteins. Avoid red meat, especially nyama choma. It is the worst red meat you can have in your system. If you're frequent with lots of red meat that has stayed in the stove for more than 30 minutes being cooked, that is bad meat for your body. It is carcinogenic, it can cause cancer, and it also brings about a lot of cholesterol, which is bad cholesterol in your blood vessels, which causes the plaguing of your blood vessels and can cause heart attack, stroke, as atherosclerosis. All this we're seeing high blood pressure. So avoid red meat and avoid animal proteins. Take it in minimal quantity. Don't overdo on it. Don't do blue band. Don't do margarine butter frequently because we're used to always applying blue band on our bread. Avoid. Go buy peanut butter. You don't have to take blue band. You don't have to take margarine in your bread. You don't. You can always have peanut butter. So avoid that. And milk, you don't have to take milk in every meal. There are people who have to take milk in every meal. Avoid it. It's also no good for your body. And finally, we have fats, oils, and sweets. This should be in minimal quantity. As you can see, it's at the top of the pyramid, which is very little. And you should not cook food with so much oil. At the same time, avoid foods with a lot of fats, oils, and sweets. That means you should take 1 tablespoon of fats and oils and 1 tablespoon of sugar in your system. And the benefit about this is that we have natural sweeteners. You can always get access to honey. You can get access to sugarcane. We have natural sweeteners outside there. And if you're prone to getting tempted once in a while, just don't overdo on a daily basis because it's not healthy for you. But as you can see here, this is the Western unhealthy food habits, and people have inverted the pyramid, and this is how people are eating. We eat a lot of cereals and starch is not good because it's pure starch, it's glucose, ni sukari. It doesn't give nutrients in your body. The moment you just take it in, it's just sugar. All it does is spike your insulin, makes you feel like you're full, and then makes you feel like you're hungry again after a few hours. So cereals and starch are very avoid the refined cereals and starch, especially all these things I was mentioning. If I was mentioning refined, there's also refined oats, white bread, pasta, white rice. We're all prone to this, like cheapo. We like a lot of rice. Avoid all of this. And we can see even here, we barely take fruits and vegetables. It's a minimal quantity. People can go for 2 days without even having fruits and vegetables. And just because you eat a banana doesn't mean you've fed yourself with enough fruits and vegetables. So we need to eat a lot of fruits and vegetables. And if it's possible, take it raw, because nutrients are not lost when it's raw. We have meat, fish, and eggs. We have so many people who are getting this. Like I said, we're exposed to so much milk and dairy products and so much meat and fish and eggs. If you're taking meat on a weekly basis, I'll suggest you go for fish. Fish is very good for you, and it has the oils that are good for your brain and for your heart. And finally, there's fats and oils. There it is, all the candy, all the pizzas, all the sodas, all the cupcakes that we like, all those junk foods that we're always craving for. When family comes, that's an excuse for taking soda. And probably you had soda yesterday. So in your fridge, you always have juice just in case you have a guest, which you end up drinking yourself and keep refilling. So avoid all these junk foods that you can see this. If a guest comes to your house, make them eat the healthy foods. And at least they'll get out of their learning. You can explain to them, we have to eat healthy. Me, I like my health more than I like my taste buds. So eat healthy. Don't always fill your taste buds with what they want. And like I said, you need to supplement. Whether you have heart health or whether you don't, it is key to supplement. And from my screen, you can see we have threonine, we have omega-3, and we have lipotropic adjunct. Yes, adjunct. So I'm going to discuss all of them in details, but briefly. So yes. So let's move to the next slide. So I'm going to start with threonine. Threonine is good for your cells. You need to correct your cells, because when you start taking medicine or when you start taking nutrients in your body, if your cells are unhealthy, the body does not cooperate. Because if you have cells that look like this, the food nutrients don't get in, so it's just a waste of time. So you have to learn, and threonine is made of all the whole grains that I just mentioned. We have wheat, rice, and soya, very good. So what it does, it oils the cell membrane so that it can make the cell new, and so that nutrients can get in easily and waste can get out easily. So this is very good, because we all started as a cell. Your body is made up of trillion cells. So if you don't feed your cells well, your body fails. It all starts from the cell. For you to start getting medication that is working in your system, if your cells are not working, it will be very difficult for the medication to work in your system. And even medication can tamper with the health of our cells. So you need to supplement and increase your intake in whole grains so that nutrients can get in, so that your performance can be like this. And threonine is such a wonderful product, because you can see here, they did an experiment. They always do an experiment on the products, and they saw that people who had an increase in threonine had increased overall growth and development. And people who had an increase in threonine, who had threonine in the system, had increased nutrients utilization. The nutrients you are eating were being utilized well. And people here who are taking lots of threonine had enhanced cardiovascular development. You see why I'm saying threonine? It helps in your cardiovascular development. We look at lipotropic adjuncts. Wonderful product. We all know when I was talking about the heart, it's all about the blood and the blood vessels. And if you take a diet that is low in fats and fiber, it causes the body to have, it reduces the amount of lipotropic factors and vitamin Bs in your body. And when that is reduced, what happens is the fats in the blood become emulsified, which increases where it's needed, and this can cause to homocysteine. So when there is very little vitamin B in your system, homocysteine can be caused to become high. And an increase in homocysteine is quite bad for your system. You need to provide your body with nutrients because it's quite important, because you need to reduce the level of homocysteine, and this comes up when you have very minimal vitamin B in your body. So you need to increase the body with so where the lipotropic agent it helps in neutralizing the homocysteine. It reduces the levels of the homocysteine so that the blood vessels and the heart itself can function on its own. So it reduces the buildup of homocysteine, which can also cause to plagues in the body. So it reduces that buildup and works on the plagues. Like I was saying, you need to take foods that have increase in vitamin B to reduce the plague. So it reduces that and works on the plague that is in your body. Another product we have is omega-3. Omega-3 reduces inflammation in 8 weeks by 68%. Wonderful product. It's good for the brain, for the heart, and for the joints. So you need to increase your intake in omega-3 because it will reduce your inflammation by 68%. And it is made from the salmon fish. And we cannot all access salmon fish. I can assure you, we were taken by my Korean teacher to a Japanese restaurant, and salmon is expensive because they feed us raw. Asians eat raw fish. It's quite nice, I can tell you for sure. It's tasty, but it is expensive. It can cost you 1,500 for just a small piece. So it is important to have foods that have a lot of salmon, which we may not be able to access. And that's why the company, when they came up with omega-3, they went for the fish, the salmon, because it has so many nutrients, and it has the 8 families of the omega-3. So it is quite good for reducing inflammation. So you need to increase your inflammation, which will also help in the good functioning of your brain and your joints. And also for the heart. And for advanced, if you have an issue completely with your heart, you need to take carotenoids. Like I said, you need to take beta carotenes. It's an antioxidant, and it reduces the oxidation that goes on in your body. This all can lead to also causing plagues in the body. So you need to increase your intake in carotenoids. You also need to increase your intake in garlic. Garlic helps to thin the blood so that it can easily, pass through the arteries. So it will thin the blood in your system. And also it's an antibiotic. So it does a lot of work in the body, but majorly it will help to thin your blood. Vitamin E, is also an antioxidant, and it's also very good for thinning your blood. So you need antioxidants in your system to reduce the oxidation that's going on. And you also need threonine, like I mentioned and talked about threonine. You will also need salmon oil. You'll also need lipotropic agent. And if you know someone who needs these products, kindly talk to them. You've seen the presentation, and you need to talk to them. You need to tell them about this, because heart health is not an easy thing to deal with. Because even doctors, when they do the surgeries and everything, sometimes not all hospitals can get access to good x-ray machines. I was reading about this, and I realized that we're in Kenya, we are not in States, guys. So some things we do not have. So some hospitals lack the x-rays that show you where the plague is in the body, because there is a machine that can tell you where the plagues are. And when you know the plague, the doctor can be able to help you get rid of them. That is why I tell you to take lots of products. And even whether you're sick or not, protect yourself. And you also need CoQ10. I forgot to mention, the company has CoQ10. The levels of CoQ10 reduce every time you get older. So you need to take these products. I am taking threonine and omega-3, and I'm a young girl at the age of 21. So you need to do this. Everybody needs to take products that are good for themselves. But if you know someone who needs this, you can always just talk to them and tell them, connect them to your upline, or if you have more information about this, talk to them. But thank you so much. Health is a prerogative, and you can always be a member of New Life, which you can get these products at a discount if you're a member of New Life. So that's one thing you can talk to the person who invited you on, how to get access to the products at a cheaper price. Well, Thank you so much for coming to this knowledgeable presentation. I hope I was loud and clear, but I am done. No more to say. I'm going to invite the next speaker, who is probably my mother. So she's seated next to me. So let's welcome my mother.
Wow. Thank you so much, Rahab.